There is a significant change in the approach and contents in the newly designed curriculum with the intention of making it more coherent for the present and future needs of the society. To brief us up with the introduction about the CBDC training program, I shall request Dr. Tarkeswar Jain sir to kindly guide us through, sir.
Good morning to all. Respected Sangeeta ma'am, Advisor to Homoeopathy, Ministry of AYUSH. Respected Swami Ji, Joint Secretary for the Jiva Trust. Dr. Sanjay Gupta, Secretary, National Commission for Homeopathy. Dr. N. Lingaraju sir, Principal of JSPS Homeopathic Medical College and Additional Director for the Department of Homeopathy in Government of Telangana. Dr. Naveen Pavaskar, Director, JIMS Institute of Homeopathy. Our commission member, Dr. Gautam Ash, Dr. Neeta ma'am, our entire core experts and subject experts from different regions, all the principals of Telangana state, Andhra Pradesh, and all the faculties from the state of Telangana, Andhra Pradesh, Madhya Pradesh, Chhattisgarh, and entire teams of JIMS Institute of Homeopathy. It is really wonderful to be over here. I can understand that many of you might have faced certain difficulties while reaching to the campus. That is definitely understandable because the campus is located a bit far in a little remote area of the Hyderabad. But once you enter in the campus, I am sure that you might have forgot all your difficulties. This is such a beautiful campus. And you feel a kind of a spiritual vibes when you enter in the campus itself. And the token of that is spirituality. Of course, Swamiji, the founder of this institute, is highly respected person to the entire India. And we have another Swamiji on the stage itself. So the vibes of spiritualities are already very much encompassed in this entire institution. So I hope, my sincere apologies to all of you for calling you all on behalf of Education Board and on behalf of the Commission itself to this beautiful campus. You might have faced certain difficulties, but I assure you that when you will leave the campus, you will be much more happy and pleased in your being. This is what I can assure you. So, coming back to my topic, that is the introduction of CBDC program for homeopathic education. This is our last workshop for the first BHMS professional. We started on 14th February, that was the Valentine Day, from the state of Gujarat, and now we are ending it on 14th of March in this beautiful campus. So the journey from 1st to 6th had been enriching to us, and we have also evolved, we have also grown, and we have also enriched our own experience also, right from the beginning to the Gujarat, and then going to the Pune, then to the Kottayam, then coming to Noida, then going to northeast to Calcutta, and now coming back again to the south to the Hyderabad. So our journey has also been quite challenging because from the moment we started and now we are concluding this session for the first BHMS in this particular campus, we have also learned a lot. And I assure you to the entire faculty, especially of these states, that all our experts are now much more experienced, much more competent than they were in the very beginning, although they all are competent, much more competent than I presume them to be. But their expertise have now grown a much higher level. And whatever the queries and whatever the inquisitiveness that you might be having in your mind regarding this new curriculum and syllabus, I am very sure that all these queries will be significantly appeased by all our experts. I am sure that you all might have gone through the content of CBDC curriculum. All of you have seen that? All of you are having the copy of CBDC curriculum in your colleges, in your record, in your department, because I am aware that many of the colleges are still not having the copies of curriculum, or they are not being distributed to the respective department. This also information I am gathering from the various sources. Although from our side, it has already been sent to all the colleges, all the universities, and all the relevant sector wherever this curriculum is required, we have already sent that. But still many colleges have not distributed among the faculties also, which is creating a little bit of problem to us also while talking about those things. Because if you have already gone through the curriculum content, then it is much more easier to interact with the faculty and to grasp the things which we really want to make you aware of. So I hope you all might be having some encounter, some sensitization about the curriculum part also. And a brief history, I just want to to inform you all that while designing this curriculum, one thing I really want to make you assure is that we have not made major changes in terms of contents. If you compare the contents of earlier curriculum and you see the content of the recent curriculum, you will find there is not much major changes at the level of contents. There had been certain irregularities in the previous degree regulations, in the previous content part that we have removed, and certain more things that is required as per the time, as per the demand of time, we have added. And you all might have also gone through the guidelines of degree regulation, where you all are aware that now first BHMS is of 18 months, and we have incorporated teaching of Mathematica, teaching of organon, introductory teaching about the repertory, teachings about the fundamental of psychology. They are all now the essential part of first BHMS, beside being the anatomy, physiology, and pharmacy, which were the routine subject in the first BHMS in the earlier curriculum. But all these subjects are now part of first BHMS, and that is being also strengthened up to the level of 18 months now. So that part is, I think you all are aware of, and many of you have already started taking the classes as per the new curriculum. That responses also we are receiving from the various sources. But one of the common perception that I am observing and the common feedback that we are obtaining from the faculty is that still many of our faculty members, even in the regions where we have conducted the training, still they are finding it difficult to follow and difficult to implement. The reason is a little bit obvious also, because earlier curriculum was just limited to the 25 pages, and now you have a voluminous document of 681 pages. So, and your habits are exactly the same, the way you have been teaching for last 25 years, and we are not here to change your habit also. You all are accomplished teacher, and we are not here to teach you how to teach. That you all know much better than us. You all are respected faculty of this particular area. So that is not our intent also. Our intent is that whatever work has been done by the board, with the help of all our experts and skilled people involved in our board, our effort is just to structure and streamline the contents. The earlier curriculum was having the vague content. There was no internal correlation. There was no integration with the subject of first BHMS. There was no horizontal integration. There was no vertical integration. There was no spiral integration. All these things were lacking. But while becoming a homeopathic doctor, you need to be accomplished in every specific part which is related to health. If you open our Commissions Act, the NCH Act, the first line is that you have to produce a graduate who is answerable to the community, to the nation, to the country, to the society, and to the every aspect which is related to the health. So we have to prepare a graduate who is answerable to the every part of society, and for that there is a need of overall development in every aspect of being known as a physician. So that effort is being made through our education board with the help of our experts, and that is the reason why the curriculum is so much elaborated. And moreover, we have focused on what has to be taught, how it has to be taught, and what is the relative importance of any particular topic that you are going to take up in your class. Whatever lesson plan you are preparing, whatever content you are developing or devising for the one particular lecture, what is the relative importance of that content in your teaching, and how your teaching can be so competent that the person to whom you are teaching, eventually, when you are assessing him, you are able to judge his quality. If you open the NEP also, National Education Policy 2020, where the only mandate is that you have to foster qualities in your student, even to the last bench student, that he becomes a responsible citizen to the country of India. So that is the duty of every teacher in every college, whether it is a homeopathic college or medical college or engineering college. This is the ultimate responsibility of every individual teacher who are in the field of teaching. So that effort is being made through our board. I am very much thankful to entire core team of our expert, Dr. Munir Ahmed, Dr. Bipin Jain, Dr. Dharmendra Sharma, who has helped a lot in formulating this CBDC program. And beside that, all our subject expert who has tremendously worked laboriously to make this exhaustive document in a very time-bound manner. All this work is being done in a very limited amount of time, and now all of them are accompanying us in the various parts of India to disseminate their knowledge and to sensitize people about what they have done in this curriculum. And one thing that I really want to request you, that this training is only for one day, but we also understand that if you see the depth of curriculum, the level of contents, and the architecture that you see in the tables and in the various structures, it is not possible to cover everything in 1 year, 1 day's lectures. But we are open to all your feedback, all your suggestions, and whatever difficulty that you face during the training and after the training also. You can come back to us, you can contact to our experts, and our only request is that you accept it by open heart, because this is now already in force. The moment our graduate degree regulation was notified on the 6th December 2022, from that very moment it has come to enforce, and the teaching from now onwards would be based on this new curriculum. So you accept it with the open heart. There would be many difficulties, I can understand. There would be many resistance also. But whatever difficulty you face, you really feel free to write us on our mail ID, and you can contact to our core expert, our subject expert at any moment of time. Once this inaugural ceremony is over, this session will be divided into two parts. One part will be the core teaching about what CBDC is. What is the CBDC? What are the intricacies of CBDC? What are the various factors involved in designing the CBDC curriculum? All those general teaching will be done in this auditorium itself in the pre-lunch session. For those, we have our expert, Dr. Munir Ahmed, Dr. Dharmendra Sharma, and Dr. Bipin Jain. They are our core team experts, and they will be taking care of the general aspect of CBDC training. Then after lunch, you will be divided into various classrooms. We have 6 classrooms which are located in the college building of GIMS. Class for Mathematica, Organon, Repertory, Pharmacy, then Anatomy and Physiology. These 6 classes are located in the various floors of GIMS Institute. And we have subject experts who will be there in the classrooms and who will be telling you how you can move ahead for implementing this particular curriculum in your specific subject. So it is my humble request that whatever time you spend over here should be utilized precisely and for the purpose for which we have all gathered here from the very distant places. So thank you very much once again to you all for coming over here, sparing your valuable time, and thanks to the entire team of GIMS for organizing this event on the request of National Commission for Homeopathy in a very beautiful manner. Thank you very much.